Okay, hello guys. So my husband is awake now
Hello everybody.
after after the surgery when we got home.
Oh, that was a long time ago.
So druggy.
How long was I out?
We got home, I guess, like 2:30.
Okay. And I think I woke up around like 8 o'clock.
So 2:30, 2:34, 2:35, 36, 37, 38. So 5.5 hours.
Yeah. I woke up extremely parched and needed a drink of water. So mouth was super dry. I got how many stitches?
He got 5 stitches.
5 areas of stitches, and then
It's like one.
I was gonna say you just point on where it is in my stomach. I don't remember. But like one is right here.
No.
Right here.
I saw one here, one here,
Yeah.
one here, one here, and then one.
One by the belly button. Yeah.
It's just like this.
All I
big.
can remember is when they brought me into the operating room, they laid me down. Actually, I was on a little stretcher thing. They had me shimmy over to the actual operating bed, and then they strapped me down. They pulled me. They had my arms like out extended on like their own little beds, and then this lady, she gave me the anesthesiologist. She gave me oxygen, and then I don't remember falling asleep. They never told me to count down. They never had a conversation or anything like that. They put me out.
So when they brought you to the operating room, so you still remember that you are in the operating room,
Yes.
and then you already have, because you already have an IV before they brought you to the operating room.
Yeah.
So they inject you.
Yeah. So this is where the IV was, and I was basically in that room for was it the pre-op room, whatever, until because they say they had like an emergency.
You like it? You got chocolate on your teeth.
Oh really?
Yeah.
Chocolate.
Isn't it chocolate?
I don't know. Oh, it's probably, I don't know.
Hold on, wait.
Probably from.
So yeah.
Yeah, so I'm in this room before I go to the surgery room, and this is where they put the IV in me, and I was there for probably, I don't know, it felt like an hour, maybe 2 hours.
2 hours, because we got to the hospital 6 o'clock, and then that's the time they opened the hospital, and then they called Marcus just to sign or check in around 6:30, and then they called you to go to the like preparation room for surgery.
Yeah.
Like 6, I think it's like 5 minutes or 10 minutes, like 6:40. So 6:40. Because remember I messaged you if they will call me.
Yeah.
So
And I asked the nurse whatever, what I would have you guys over there, and they said yes, they would be able to bring you over to the IV once I get the IV, which I had at that point. So they said, what was your number? And luckily I still have my phone, because if I didn't, I would have been like, I don't know.
don't memorize my number. So yeah, so he called him like 6:40, and then so they only, when they bring you to the preparation room, what did they do to you? Asked you, because when we got there, so the nurse called us around 8 o'clock. So 6:40 to 8 o'clock, we've been waiting outside in the waiting room. So when we got to the like preparation room or something, he already have an IV, a screen for the BP or whatever, and then he already have a like a silver blanket. I think that is for you to not feel cold.
Yeah, it was. I mean, it was a very light blanket, but I wasn't cold anyway, so it was actually fine.
And then he's already wearing a gown, no clothes at all.
Yeah, they put all my personal belongings in like two.
Also, they are
bags.
the one.
No, I did.
Okay.
Yeah, they basically like closed the curtains, and I stripped down to my birthday suit, put all my clothes. I put my shoes in one bag, and then my clothes and stuff in another bag. And the lady said that I could keep my phone on me, so I was like, okay. And that's how I was able to message you, you know, and send you those 2 pictures.
So I guess the gown size is standard because Marcus is 6'5". 6'5".
That thing was like a
6 foot,
mini
6'5".
skirt. It was a mini skirt on me. It
Yeah.
was like way above the, like 4 inches above the knee.
So
Like,
it's just a standard size for, you know, normal height people or whatever.
even
so
the bed.
it's too
the
short.
bed was standard size. It felt like my feet were hanging off.
Yeah, so it's like this is his knee.
No, this is the end of the bed, like right here, and all
And
this
then
is hanging off
all
the bed.
this are hanging.
So,
So yeah. So okay. So they called us like, what did it say, 8:15 or 8:30, and then
This is all AM.
yeah, morning. So what did you recall? What did they ask you? So aside from putting you an IV
They
and
asked me if I had any-
monitor.
They asked me if I had any allergies to any medication. They said if I had anyone here, and then they asked me. Yeah, that was basically the only 2 questions, really. They're just like, do I have any allergies? I said no, and then they said, is there anyone here with you? I said, yeah, my wife and daughter. That's it.
Okay, and then so when we got there, so like what I said, he's already on the bed with the IV with the monitoring screen, and basically we just waited, and
Yeah, because they had to get the prep room ready because there was an emergency surgery that would happen overnight, so they had to take care of that first, and they said that they were cleaning all that up before. Because one of the guys came to me, and he spoke to me and said that I was first in line, actually.
oh really? That is, you are first in line.
That's what he said. He said,
We waited like how many hours?
this goes to show you, first in line is not necessarily like the quickest, but they said I was first in line because of I was able to get everything done quickly. I was able to get changed, ready, IV, and all that stuff, like before everybody else. Everybody else beside me, like on each side of me, of the pre-op room, they all had like crazy like stories. Like this one lady said, she's like, the lady's like, do you drink? Do you smoke? She's like, I smoked marijuana like 2 weeks ago. And then the other guy was just like, yeah, man, I drank like 24 less than 48 hours ago. And then it was like people just, I guess they got their advice that yeah, you need to come to the hospital and have surgery on this day, but they're like, yeah, I'm just gonna like live my life up until the day. It's just kind of crazy.
So and then we waited to the preparation room, and then the anesthesiologist
Anesthesiologist.
came. That's around, I think, 9 o'clock in the morning, and then she gave him 2 of the aspirin.
Yeah.
So he took it.
She said it was basically to chill me out, and I was like, well, what if I'm already chilled out?
So yeah, and then so that's 9 o'clock, and then they took him to bring him to the surgery room. I think that is basically I think 10 o'clock.
10 o'clock. Oh.
Yeah, so 10 o'clock. So 6, 7, 8, 9, 10. So we waited 4 hours basically to check in, to do things on the preparation room. And then yeah,
The actual surgery itself, though, how long did that take?
1.5 or 1 hour and 45 minutes.
Well, when I remember getting wheeled into the room, there was the doctor that was going to do it, the anesthesiologist, there was another
The doctor, the surgeon.
surgeon, yeah.
Okay.
And then you had, there was another lady, I guess she had introduced me earlier. She was the one that actually walked with me with she pushed the table. So when she pushed me on the table, there was like the anesthesiologist and that other lady. So she was there. And then there was like 5 other like nurses or scrubs and stuff that were in there.
But how many surgeon is there? Because
Just one.
the one that we talked to the hospital before.
Yes.
Because the doctor who talked to me, he told me that he is a surgeon, and then he's looking for me, because they have this thing that they will update the family of the patient, like a text messages, like he is already in the operating room, they already start the procedure, and you are doing well during the operation.
Yeah.
And then they will text you that the operation went well, the surgery went well, and then they will message you that you are in the
Post-op.
yeah, the recovery room.
Recovery room, yeah.
So yeah, so I've been waiting for the text. So it's like
They didn't text you?
they texted me. It's like they texted me that they already brought you to the operating room, which is I know, right, because we are there. And then they messaged me that they are starting the procedure, and then they messaged me like they're still in the procedure, and then you're doing well. And then they messaged me that what do you call this? They messaged me twice that you are still in the procedure, and then you're doing well. And then I've been waiting to receive a message that they already done with the procedure, and then you are doing well. So I've been waiting for that, but I never got it. I did not receive anything. That is like 1 hour and 30 minutes passed while we are waiting. And then so there's this doctor who came. Well, he's looking for me. He said, Mrs. Campbell? He said, yes, doctor. I said, I'm this. I'm the surgeon of your husband, Marcus, and we are done now, and he is doing well. And then so he said, how are you feeling? I said, I am really nervous. I'm so worried and I'm shaking. Between, that expand time, that 1 hour and 45 minutes, it's like I wanted to play on my phone. I wanted to do something on my phone. I can't, because my heart beats fast.
Yeah.
I keep on praying, like with that range. I keep on praying that everything will went well. And then so he talked to me, and they said everything is okay. And so I said, so did you already take it up, and did you test it that it's benign? And then he said, so we already took out everything, and they sent the sample of the gallbladder polyp to the laboratory, and then they will test that. And then he said that they will know the result, and we will keep us posted, which is, I guess, August 4, because we need to come back for your pre-op.
No, post-op.
Post-op on August 4. So still, I'm thankful that your operation is successful, the procedure is successful, but I'm still in hanging. We're still in hanging, because I really wanted to know that and praying that it's benign. Until I know that it's benign.
Well, he said it was a win-win, because if they excuse me, he said that the fact that they found the polyp as soon as they did, getting the gallbladder surgery will remove the polyp completely. And they said there was not that's the only area that it was found in. It wasn't found out and around it. So
Oh, so it's inside the gallbladder?
correct. So you know how think of the gallbladder as a small balloon. So the gallbladder the polyp would be on the inside of the balloon, right by the hole of the balloon. So if they remove that, and there's no other gallstones or anything like, or polyp stones, whatever, on the outside of the balloon, then it's basically like they cured me of it because they took it all out.
So there is no polyp outside the
Correct.
gallbladder. So
Correct.
it's inside the
It was
gallbladder,
just
and
like
then
that small little 10 millimeter piece that was at the inside. That's what they explained to me.
okay, because his polyp is 10 millimeter and it's big. So the doctor explained to me it is okay to worry, but you know, he said there is a least chance that it's cancerous because they already take out everything.
Yeah.
So yeah, I said okay, thank you so much. I have a lot of questions to the doctor, like how long you can drive, the recovery period, what food you can eat or you can't eat. There's a lot of things that I want to ask, but my brain is like blacked out because
I have very little questions for the
I'm
doctor.
so well.
He asked
Me.
He asked me, like, do you have any questions on, like, am I going to survive? And he's like, yeah. He's like, they do over like 8,000 of these like a year or something. These types of surgeries, and it's like one of the most common surgeries. So he
okay.
said he had nothing to worry about. He said that there was like he said it was like a 1 in 1,000 chance that something will go wrong in this type of surgery, and he's like, but it's very, very low chance of that happening.
So when the doctor looking for me, because he said I've been looking for you all around, and it's like, because when we are going outside, when they brought Marcus to the operating room, the nurse show us where the exit is. So you know the check-in room, right? So the check-in room, basically we just exit there, and then there is a like surgery area, like waiting. It's not a waiting room, but yeah. And then there is a bendo machine. There are chair there, and then they also have a patient family lounge. But I did not wait there.
A patient family lunch?
Lounge.
Lounge. Oh, okay. I was going to say there was a patient.
I said lounge.
I thought you said there was a patient friendly lunch, but I did not wait there. I'm like, why not? Why
Lounge.
did you wait there? There was free lunch.
But well, if I know that they have the patient family lounge because there is a sign, like the arrow thingy.
Yeah.
But I did not know that it's different because they have coffee machine, they have coffee cups, they have the like 3 bendo machine there, and then they have some snacks for the family of the patient. I did not know, because if I know, we went there, and then the couch is
That's where the nurse took you, or the nurse took you out of that place?
no,
Okay.
it's different.
Because I'm wondering if that's where they would have
You know
called
where? Yeah, that's the thing. I think they called me there because when you call me, you said they are calling me, right? I don't know if they're calling me basically on my phone or just internal, like in the hospital.
I don't know. I would assume they would have called you on your phone.
Yeah,
They asked for your phone number.
Yes, because the nurse told me, the lady who brought you to the operating room, she explained to me, and then the lady who got my number, she explained to me that your nurse will call me if you are ready.
Right.
So that's what I'm thinking. That's why when you told me that they are calling me, I don't receive any phone calls. So, when you told me that they are still looking for me, I went to the checking room, and it's empty. No one there. No one there. So I see a paper, like a note. It says that the family of the patient should go to the patient family lounge.
Please, you know
So
you
I
will.
told it
Where you were before.
No.
That's where you
Just-
were before.
just outside the check-in room, but not in the family lounge. So we went to the family lounge. There's no one in there, but I guess the receptionist is there. And then I said, "Hi, ma'am. I'm so sorry because my husband told me that that his nurse, that they are calling me." And then he said, "What's your name?" I said, "Yeah, Mrs. Camper." He said, "Oh, okay. Yeah, I've been looking for you." That's the one that said, "I've been looking for you." He said, "Oh, I'm so sorry because I did not know where to wait." There's no specific instruction where to wait. So,
for future reference, patient family lounge is where you're supposed to wait.
I didn't know that they have those because it's a separate room. It's all the way on the other side.
Yeah, I got you.
And then so she called the nurse, but I think that is her nurse. She called the other nurse, and then basically when she's still on the phone, your nurse called me. She is asking me where I am. So I told her I'm in the patient family lounge, and then yep, and then she said she will call the receptionist there to talk to her. So I told the receptionist while she's waiting on the phone, I told her, "Oh, my husband's nurse told me to tell you that she will call you." So yeah, so after that,
Sorry. Oh,
the receptionist told me that to wait where I am waiting before, which is basically, I guess she knows because she told me just wait there, like when I saw you beside the vending machine. So it's like, okay, you already saw me waiting there, so you know that I'm there.
Hard.
But I don't know, basically maybe she doesn't know that I'm your wife, that I'm Mrs.
Well, they deal with a
Campbell.
lot of people, so it's kind of that understand. That makes
Yeah,
sense.
yeah, it makes sense.
Yeah.
But so supposedly I am the one who will pick you up at the recovery room, but the receptionist said I'm with the kid, with the nurse. So basically we cannot
Yeah.
go back there.
Yeah.
Because they said kids are not allowed inside. Like the
Yeah.
first time I told you that the nurse said, "Oh, I did not know that you have a kid. She is not supposed to be here."
No.
So she is rushing to give her the mask and give me the mask. And then she said, let's walk faster because she cannot see through here, like walking, going inside." So yeah, so kids is not allowed inside the preparation room. So, yep, so
Nowhere is that listed anywhere. Nowhere is that told us anywhere beforehand. We would
yeah,
have
for the
like-
first, yeah.
We would have made arrangements for all of that, but of course,
Well, they did not say anything when we are inside, so I guess
yeah,
it's okay
it's not
as
that big
long,
of a deal. I mean,
as long as your kids are behaved, and then they are not making noise.
yeah.
So, and then I did not know I'm waiting for you to exit on the,
6'5".
where the
4'3".
check-in room is. There is an exit there. I'm waiting you to exit there, but you exit on the other side. So,
Hey, now you know how it feels when I was waiting for you to come in from the Philippines. I was waiting for you to come down the stairs, but you came down from the other side.
there's a lot of,
Yeah, you finally, I
there.
finally did it to you.
So when you called me and said, "Oh yeah," and then I'm so glad that is that your nurse who helped you out with a wheelchair?
I think so. I don't know. I think because I had a blonde lady that was the first one, and then this lady when I woke up was a black lady with blonde hair. So it was a different lady.
So who helped you out to get dressed? So you
Nobody
wear
helped me out to
shoes.
get dressed. I did that. No, I did that.
So you bent and everything?
Yeah.
Well, the bag was right there on the bed when I woke up, and then she's like, "Okay, go ahead and get dressed and stuff." And then she like exited and closed the curtain, and then I got dressed.
So it's easy for you to wear your clothes and
Yeah, it was
everything.
fine.
So yeah, but good thing the nurse helped him to push his wheelchair because yeah, I'm pregnant. I cannot do that basically because I guess he's so heavy.
I was just about to say, like, I don't remember walking down to the Uber. I was like, oh yeah, I was in a wheelchair. I just remember that.
And then I have with Daenerys, and then I have a bag, so it's like too much for me if I will push Marcus' wheelchair. So thank you for the nurse who helped my husband, and because he pushed Marcus' wheelchair all the way to the ground floor.
They kept
to
saying,
the outside.
before we even got in the elevator, she's like, before I even left to come see you, she's like, has she already called your Uber? And I was like, no, not yet. I was like, what? I was like, I drive. I didn't say this, but I'm thinking, I drive Uber. If by the time that we called the Uber and got to like the elevator, the Uber would have already been there. It would have been like,
Yeah, it's only like what I told you when I request the Uber, it's only 1 minute. That's why
exactly.
I cannot call the Uber when we are upstairs
Yeah.
because it will took you how many minutes?
it took us at least
you
3
know?
or 4 minutes just
Yeah.
to get down to the lobby
To
and
get
whatnot.
down.
So I was like, yeah, I'm.
So yeah. So okay. So basically we got home around what time is that? I guess 2 o'clock. Yes, 2 o'clock or 2:30. That's the time we got home
In the afternoon.
in the
Yeah.
afternoon.
Say that. It sounds like
And
2:30.
then he went to the bedroom, and then he's very druggy.
Dude, I was so groggy.
Like his voice, you can tell it on his voice, and then his how he walk or
I think
you know.
we called my boss at one point
yeah before.
before I went to bed.
Yeah,
I'll let
but
him know.
yeah. So yeah, so the whole everything is like 6 a.m. to 2:30, 6, 7, 8, 9, 10, 11, 12, 1, 2. So basically 8.5 hours by the time we get there to get home. But the waiting area is the waiting period to start the procedure is 4 hours, like including the check-in to the pre-op, and then the procedure is 1.5. Actually, the procedure, it depends if they will they call it laxo something. If there is, they will cut you. That will take 1 hour to 2 hours. So that is the one that they did to you because you have incision, like a cut, 5 cuts. And then, but if they will just put it on the butt, that is only like 30 minutes, like without wound. So yeah, basically his procedure took 1.5 hours. And yeah, and then there are restrictions. So after the surgery, he needs to rest, like fully rest, 24 hours, no driving, no walking. Well, walking like a little bit, but as in 24 hours fully rest.
They said it's important to move around a little bit because of blood clots. You don't want to get blood clots. So.
Yeah, so that's 24 hours. And then, but no lifting more than 10 pounds. No lifting for 2 weeks. 2 weeks to 3 weeks. As in nothing at all. 2 weeks to 3 weeks, nothing at all. But 3 weeks to 6 weeks, no lifting more than 10 pounds.
Yeah.
And
so
then
basically light duty for a month and a half.
Yeah, and then no driving for 24 hours. And then no eating fatty foods for 24 hours or for 2 weeks. So there is a diet restriction, there is a weight restriction like lifting, and then there is a driving restrictions. So basically those. So because I wanna ask you what happened to the operating room, but since you said you don't remember
All I
anything.
remember is me laying there with my arms extended. I was like strapped down to the bed, and the anesthesiologist gave me oxygen, and that's basically it. Like I don't remember anything except for that.
So did they wake you up or you wake up by
I
yourself?
woke up by myself. And when I woke up by myself, I was already in the other room.
You are in the recovery room?
Yeah, I didn't feel anything. Didn't.
Or because maybe the anesthesia is still there.
I mean, it's completely painless. So
We can show you his wounds. Is that okay?
Yeah, that's fine.
We can show you so you will know. Yes, like 5 stitches. So yeah, basically those are the step-by-step process if you or your family members will undergo a gallbladder polyp removal. Okay, and please continue praying for my husband. I keep on praying that it is benign and everything, as in everything will went well, no after side effects or no after what do you say? Complications.
Yeah.
No after complications, just fully like
Fully recovered.
recovered. So yeah, please pray that it is benign. I am still stressed for that. I can wait. I can fully breathe once I know the result that it is benign, so I will not worry about anything. Because I was thinking your full recovery is 6 weeks. So it's like by the time I already delivered the baby. Because I am 33 weeks now. 33, 34, 35, 36, 37, 38, 39, 40. So I have 7 weeks.
7 weeks left, yeah.
7 weeks left, but right now I am feeling that
You'll pop at any moment.
yes, it will pop any moment because
Her
I
belly
feel
button has out.
yeah, it's already out and my belly is too low now.
Usually when cooking a turkey, when the thing pops out, that means
It's
done.
already cooked. So yeah, and then he's very heavy, and then I feel the pain on my pelvics now that it really hurts so bad. So it's like when the baby moves, I feel it in my pelvic. So it's like that's why I keep on talking to the baby that not now, because we still have 1.5 month to wait. It's okay for him to come out if it is like 2 weeks early. That is okay with me, like 38 weeks. But I'm only 33 weeks, so no, not yet.
You gotta remember, he's the boss now. So
But that's
You
1.5
him.
weeks. So yeah, please keep on praying to my husband. So we will show you the you see. Oh, by the way, is that a stapler or no? Like mine after I give birth to the nervous. Did they tell you?
I think that they're stitches actually, just like I don't know if they're the same type of liquid stitches that or whatever clear stitches that they used for you when they did your operation. I think these will dissolve over time, and
Just like mine, it will dissolve.
yeah, they said basically just run like warm water, and then like all of it will eventually come off.
Because I remember, because I'm looking for your stitches. You will see it. I am looking for his stitches. You can see the stitch. But mine, during my C-section on the nearest, you cannot see the stitches. It's just base line. You
Yeah,
will
it's the
just
line.
see the skin.
Yeah.
No stitches. But his, you can see the stitches. That's why I'm nervous to look at it or touch it. Okay, so the moment has come. Let's look at this. Regular incision, his stitches. Okay, so this is his stitches. Oh God, I feel hurt. So 1, I will focus it first. Then 1, 2, then here 3. Oh, you only have 4. I thought 5.
One by the belly button.
Oh, there's one more. 4. Oh, it's inside.
I don't know. You don't see one by the belly button? Maybe not.
No. So there's only 4 belly button. I think I see it, but I when I first check it, I see it's fine. So basically, it's like this. So like that. See, 1 in here, 1 in here, 1 in here. This is the biggest cut. Oh God, that's the biggest cut. And then there's 1 in here. And then, yeah, as you can see, there's still red. I think that's the dressing that they put it to, so Marcus cannot feel it. So basically he's sleeping. So if you see, there is like some glue in there. Oh, If you see it, see, oh, there is a stitches. Oh God, I'm so sorry, guys. So yep. Yeah. So yeah, those are his stitches. I know it's 5, but when I look at now, I don't know, it's just 4. So yeah, so the doctor said basically we'll just,
when you run like warm water over it when I shower and stuff, he says that it will flake off
okay.
all that stuff. So I don't think I'm getting stitches taken out. I think it's literally just gonna heal.
Because sometimes they said they use a stapler or something, but you have to go back there because they will take it out
Sheesh.
for
I
you.
couldn't imagine staples.
So yeah, so that is the run through. If you were having a gallbladder polyp removal, well, case
Gallbladder removal, basically.
gallbladder
Yeah.
removal. So basically, it really depends on what procedure they will do to you. But if it is like for Marcus, so yeah, those restriction, the length of time, so those the things that you will undergo. So yeah, please continue praying for my husband and pray for me too, because you know, for the baby.
So 7 more weeks left.
7 more weeks, but I really hope it's 7 more weeks, not too early, because we're not ready. The reason why I don't want the baby to come out right now because of Marcus' situation. I want Marcus to be fully recovered before the baby come out, because I know how stressful it can be that I am in the hospital, in the operating room, and then Daenerys is here, and then, you know, lots of things like emotional,
I should
spiritual.
I should be healed by then, so we probably don't have to worry about that.
Yeah, that's why I'm really praying that he will not come out early.
Yeah.
We need to wait at least 6 months for him to come out. Well, basically,
6 months?
six weeks to come out. So basically, it's a C-section. So I already scheduled September 7th. So I just hope, yeah, September 7th. So yeah, thank you so much, guys, for watching. And if you have questions, clarifications, feel free to comment on our video. Have a great day.
Take care, everybody.
Bye-bye.